Gentlemen of Trinidad and Tobago, at home, and wherever you might be following us on your various platforms, welcome to our usual reporting on our management of our COVID challenges. And I want to give a special welcome to members of the media who are here in person with us. And once again, we will start in the same format that we normally use, asking Chief Medical Officer Dr. Parasham to lead his team in giving us the very latest on our COVID numbers and responses.
Thank you, Honourable Prime Minister. Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. We begin with the new format dashboard for today. So this is 14th of January 2022. Fully vaccinated persons so far, 48.5% of the population. If we break it down further, 678,667 fully vaccinated. Those with first dose or no doses stand at 721,333. Those who have received boosters so far, 97,196. Total new positives over the last 24 hours reported 853. Deaths reported in the last 24 hours, 22. And condolences to the families of all of those who would have lost loved ones during this time. Total active positive cases at 16,019. Those in hospital, 621. And it includes both hospital and step-down facilities. And total deaths today, 3,156. We're looking at the vaccination status from July 22nd, 2021 to 29th of December 2021 on the right-hand side in the pie chart. We see those who are fully vaccinated in terms of being in hospital, either step-down or hospital, accounting for 14.1%, 85.6% not fully vaccinated. Just going a bit further into the deaths in terms of vaccination status, small green bar on the top, 177 persons would have been fully vaccinated as at the 12th of January 2022. And on the bottom bar, all of those persons would not have been fully vaccinated. We're not counting in terms of our percentages the first 390, because those deaths would have been prior to persons being able to be fully vaccinated in the country. The large blue bar, 2,552. So basically what we're seeing in terms of a percentage, that an unvaccinated person is 15.6% has a greater chance of dying from COVID in Trinidad and Tobago. So Dr. Hines, if you can go into further detail.
Thank you, CMO. Good afternoon to the Prime Minister, Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. We just put the dashboard back up for 1 second. Just going to continue with the CMO left off for a minute, just looking at that, the death rates in the two groups, the vaccinated versus unvaccinated. And if you look at the proportions there, what you see is that basically there is a large reduction in the rate of death. And if we look among the vaccinated, and if we actually compare it, that rate of death is about 15.6 times higher. So if you're unvaccinated, then the death rate in that group is 15.6 times higher than the death rate that we're seeing in the vaccinated group. And we want to make that point because the queries about whether vaccines are helping or working, our data is showing that it's actually making a difference. Let's go straight into the epidemiologic update. So, next slide. Looking at our epi curve, we have a historic, or what we call an anamnesis here. Looking all the way back to July 2020 and coming forward, we see that the August spike, which looked big in August, is now dwarfed by the activity that we saw with the introduction of new variants. So we saw the Gamma variant get introduced somewhere in the April period, and the spike that would have followed. We saw the Delta variant get introduced later on in the year, and the spike that followed that. And we're pointing this out because, again, we are on the doorstep of the introduction of another variant which is considerably more transmissible. And we're bracing for a similar sort of scenario unless we do certain things. And the certain things won't necessarily prevent, but it will definitely blunt the impact of that similar scenario. And those certain things are the things we've been speaking about: the vaccination, the public health regulations, the washing hands, wearing masks, watching distance. Numerically, if you look at the same data at the weekly time scale, now just looking at the years 2021 and the beginning of 2022, we see that in December, which is the red bar area over to the right-hand side, we did see what looked like a big drop in week 52, but we have pointed out that that drop was really more a function of what we call health-seeking behavior, where fewer people would have gone out to test in that Christmas week, and therefore you got fewer positives. And you saw what looks like a rebound, or what looks like an increase, but it's really a rebound to the more expected levels in that first week in January. Second week in January isn't quite finished yet, so we have to see what today's figures bring before we can compare the heights of those two bars. But we are seeing at the present time what appears to be a very small incremental decrease. We would hope that that continues, but we are aware of the potential for that to change rapidly if Omicron seeds and begins to take hold and do what it has been doing in other countries, in other jurisdictions. Moving to this really just shows the same data, but now the numerical changes from week to week, so I won't harp on this. This can be reviewed at your leisure. And if you look at the monthly data from January 2021 all the way through to January 2022, we see that December was a record-breaking month in terms of numbers of new cases, and that in the first week or 2 weeks of January, we haven't quite halved December's numbers, so that looks hopeful. But we still have to see if that downward trend continues. So we're saying hopeful in inverted commas, but we all would like to see the numbers come down. We will see what the trends actually manifest as we move forward. The trends in terms of demographics have not changed. So the same age groups are getting affected. The same male-female balance, approximately 50-50, has been maintained throughout this, even with the big spikes. No big swings in the actual distribution. Right now, still that 25 to 49-year-old age group being the dominant band of the positives, representing 51%. And among the fatalities, we still note that the fatalities have occurred, at least two-thirds of them in individuals over 60, and about 60%, 57.7% being male. And the other factors that factor into the fatality rates are the presence of comorbidities and the absence of vaccination. Without harping on it further, moving on to just what's been seen with the projections that we had been making at the end of November, from middle of November to the end, the pace at which we were going, represented by that last upward dotted line, sort of dark red. We haven't seen that pace continued. Some of that was due to the blunting that we would have seen as schools would have closed and people would have come out of the office during December. So you saw a little bit of a dip in the heights of those blue bars as the heights continued to rise. And now we're seeing, again, a little bit of an upward incline. So not major changes, not a major breaking force, but we did see a little bit of a slowing, and we would like to see more. And the only way we're going to see that is if we continue to raise our vaccination rates and continue to adhere to those public health guidelines. So with that, I'm going to wind up the epidemiologic update and turn you over to Dr. Richards.
Thank you very much, Dr. Hines. Good afternoon to the Honourable Prime Minister, the Honourable Minister of Health, the Attorney General, the Honourable Minister of Energy and Energy Industries, Office of the Prime Minister, and the Honourable Minister of National Security. Good afternoon to members of the health team and to members of the media and to the viewing and listening population. Today I'd like to present a summary of the status of the hospitals in the parallel healthcare system as of January 15, 2022. The net number of admissions, that is the additional number of patients that we see in the parallel healthcare system, has been between 121 and 154 over the last 5 weeks. And last week, we saw less patients and a bit marginally less patients than the previous week. So last week we saw an additional 128 patients as opposed to 159 patients. Not a very significant decrease, but still a bit of a decrease there. The parallel healthcare system continues to see a high number of patients, and as of this morning, there are 623 patients in the facilities in the parallel healthcare system, with 482 in hospital and 141 in step-down facilities. We have noticed over the last 2 weeks a slight decline in the actual number of patients who are being hospitalized in the system. This graph just demonstrates the trends that we would have been speaking about, and at present, the trend that we are looking at is going on for 88 days now. Ward occupancy continues to be high. This morning, we are at 70% occupancy. We did peak at about 81% in the last week of November. However, the ICU occupancy is at 88% this morning. This morning, 70 out of the 80 available beds in the parallel healthcare system are filled. And we do have patients in the accident and emergency departments that we are treating. HDU occupancy is at 71%. Now, over the 88-day period that we are discussing as with these consistent trends, ICU occupancy has been on average 89%. So on any given day, 9 out of 10 ICU beds across Trinidad and Tobago are filled. We have noticed a decrease in the number of patients in the accident and emergency departments who require treatment for COVID-19. This morning, there are 87 patients across the 10 accident and emergency departments in the traditional healthcare system, and of those, there are 16 ICU-level care patients. Ladies and gentlemen, over the last 88 days, our hospitals and accident and emergency departments continue to be progressively strained by a significant number of COVID-positive patients who require critical care, especially ICU care. The vast majority of these patients are not fully vaccinated. The reality is that the Omicron variant is on our doorsteps, and our hospitals are still at 70% occupancy with a critical threshold of what we speak of 75%. As I end my presentation today, I would like to appeal to each and every one of you to please exercise all recommendations and guidance that we are providing to prevent yourself from becoming a patient in the hospital. We continue to ask you to please become vaccinated. Please receive your booster and access your booster if so required, if you require a booster at this point. Also, if you have symptoms of COVID-19, isolate. And if you are becoming more ill and you're noticing, that you're becoming more critically ill, please, when you contact the ambulance, come to the hospital. We continue seeing a significant number of persons refusing care and denying care. And please do not use treatment regimes that are not approved. This is the only way that you can give yourself and your relatives a fighting chance. Thank you very much.
Thank you very much, Dr. Richards. I'd like to ask Dr. Trotman to give us a little commentary on what she's seeing in the hospital.
Honorable Prime Minister, ministers, fellow members of the health team, Chief Medical Officer, members of the media, members of the public, and members of the health team. The medical system, health system, continues unfortunately to be challenged by numbers of patients who are moderately to critically ill that present themselves for care. These patients are unwell, not healthy, having underlying comorbidities, inclusive of hypertension, high blood pressure, diabetes, which is uncontrolled either because of their underlying condition or because of the coexisting COVID condition, who also have underlying lung diseases, in some cases cancers that they are being treated for, renal disease, and patients who are obese. These patients also are characterized as patients with comorbidities. What we see clinically are patients who have symptoms for a period of time, usually 5 to 7 days, and even longer, who more and more we are seeing are being treated by home physicians and then entering the medical system at a time when they are critically ill and sometimes too advanced for us to make the changes that we can if they would have presented earlier. The medications being used at home do not always fit with the guidelines that are being used in the parallel healthcare system. And of course, the monitoring is not one where we have continuous monitoring so that if a condition changes and you are right within the healthcare system, we can act accordingly. So we are seeing still large numbers of sick patients with underlying comorbidities being treated by home physicians, entering the system at a late stage for care. We urge you all that the healthcare system is there to support all our patients who are unfortunately afflicted with COVID-19. And we ask that you access that system if there is need earlier rather than later, so that we can make that big difference for you. We have to stand on the pillars. The public health measures are critical. I always say they are on our foundation. If we don't have a strong foundation, we will fall. So the 3 W's are there for us: to wear our mask, wash our hands, watch our distance. And on top of that, to strengthen that foundation, to help us protect ourselves even more, keeping in mind that we are now possibly dealing with a community spread of a virus that's much more communicable, meaning that we see more numbers. And even though ultimately it means that you may be less ill if you are vaccinated and if you are well, it means that we will still see more people coming into the healthcare system because there are more people afflicted. So that vaccine, here that vaccine comes. We have lots of choices. We urge, we encourage, we beg you, please take the vaccines that are before you to help to strengthen yourself in the fight against COVID-19. As a healthcare care professional, that's the biggest thanks you can give us, is to become vaccinated so that if you do get the virus, you have a better chance of surviving. Thank you very much.
Thank you very much, Dr. Trotman. Ladies and gentlemen, the last time I was with you here was on the 18th of December. And it might be useful now to indicate where we were at that time, where we are now. Because on that day, I did make some far-reaching interventions, and those were based on us appreciating that we were still in a pandemic. And I need to say that in Trinidad and Tobago, because there are some voices, loud voices in this country, which appear to me to be taking the position, along with some members of the national population, that the pandemic is a thing of the past and it is something to be trivialized, and more than that, that the government is overreacting. Some people go as far as to say that the government is overreaching, breaching the Constitution, and of course many people in the minority of the country's population, of course, are saying that their individual rights are being either trampled upon or threatened. Against that background of state of affairs, I simply want to say to the population of Trinidad and Tobago that this is the third year of the pandemic of 2020, 2021, 2022. We still do not know and do not have a clear horizon as to when we might come out of this situation. It might very well be that we have to keep fighting it for some considerable time. And in that situation, the best responses are very well known to us. You would have heard them from Dr. Trotman, and I would now want to ask the Minister to deal with the vaccination side of our response.
Thank you very much, Honorable Prime Minister, Cabinet colleagues, Dr. Palsram and the health team, ladies and gentlemen of the media, ladies and gentlemen of the public, wherever you are, Happy New Year to each and every one of you. So the current vaccination numbers as of close of play last night, fully vaccinated 679,282 persons, which represents 48.5% of the population. Those accessing boosters to date, 98,490. 98,490. From Monday, December 20th, up to Monday of this week, which was Monday the 10th of January, we did see an increased uptake in vaccines, where we were averaging about 0.1% per day, 1,400 per day, 1,500 per day. And that trend held from Monday 20th December to Monday 10th January. We started to see a decline from Tuesday of this week, where we went down to 1,302, Wednesday 1,159, and then unfortunately Thursday and Friday we dipped below 1,000. Thursday we did 944, and yesterday, Friday, 911. So our first shots, which includes the first shot of Sinopharm and Pfizer plus J&J, is now below 1,000 a day. That is not good enough. We need to get that up. Also, we want to encourage people to come in to be boosted based on a schedule we have published. All the global evidence tells us that one of the ways to beat Omicron is to be boosted. The first and second shots may not be enough. You need that third booster. So we want to urge people to come out, start your journey to full vaccination, start your journey to be fully boosted. The sites are open. They are there. They are convenient. They are free. And all the reports are that people are raving over the excellent treatment they get, how fast they are in and out. In some countries, you have to line up around blocks in wintry weather to get vaccinated. We don't have that here. It is convenient, easy, free. And as the doctors will tell you, vaccinations are what is going to help us get out of this. Thank you very much, Prime Minister.
Thank you very much, Minister. Well, you also, as we look at state of affairs in the country, we have to also acknowledge that a significant part of the conversation has to do with choice. I simply want to say that from day one, it has been and it continues to be an issue of choice. You may recall that we started out, and I mentioned this last time I was here, we started out with open choices, leaving it up to the population to make that choice. And we were finding, for example, with the wearing of masks, with the congregation of people were partying still, people were not wanting to wear the mask, and there had to be a governmental intervention to say, okay, make the mask mandatory, outlaw parties and enforce it using the police to shut them down and so on. So it has always been about choice. But then if you don't get the required response, there's a role for the government to intervene. And that is where we are with respect to the vaccination program. In the third year of a pandemic, where we are reporting every day upwards of 20, sometimes as many as 30 people dying from a virus for which there is some amelioration that's available, some response that is medically authorized. And of course, I want to ask the team to put up the dashboard. And while they're doing that, let me just say this. I also notice that a lot of the conversations in this country very pointedly ignore the fact that what the government is looking at and is trying to respond to are the number of deaths in Trinidad and Tobago associated with COVID. It appears to me that, to some voices, over 3,000 people dying from COVID is not an important matter warranting our conversation during the daytime, our response in the 24-hour period of each day. Today the figure is 3,156. I want to ask you to look at the bar at the top. Population vaccination status, green and blue. What that tells you is that after all that we have done since June in vaccinating, and we have vaccines available, we have vaccines by choice in this country, let it be known that half of the population of this country, in fact 721 is against 678, just a little more than half of the people in this country are not vaccinated. That is a fact. Now, when we look at other countries who are heavily vaccinated and who are also being challenged very severely by the virus in its very many forms, the latest is Omicron, it tells us that we are very exposed. Because if the heavily vaccinated countries with far more resources than we have are finding it difficult to dismiss the variant, to dismiss COVID-19, what exactly are we ascribing to ourselves? Some kind of superiority? Some kind of pass? The most we can say is that we are to expect that we too will experience what they are experiencing, because it's the same virus. Contrary to what you might hear from some people, the virus that we are fighting in Trinidad and Tobago is the same virus that the rest of the world is fighting. Same variants that the rest of the world. And when the variants appear from wherever they are, in which corner of the globe, we have to pay attention, but pay attention to that fact that only just less than half of the population is vaccinated, and vaccination is the best response of the human race to a virus which has already killed, 5 million people? And in Trinidad and Tobago has already killed over 3,000 people. And that is what the government will respond to. That is what the government is responding to. Because this country has a government and will have a government. Unfortunately for me and this government, this is our portion. We are required at this time to respond to this. I want to take you to the pie chart on that's a circular one out there with a little slice of green. What that tells you, these are patients in the hospital. Vaccinated patients, the whole circle has the population of patients in the hospital. The green, who have gone into the hospital system, are the vaccinated people. Nobody has said that vaccination eliminates the possibility of getting infected or requiring health care in an institution. Nobody has said that. It has said that you are much better able to respond to the virus if you're vaccinated. That chart shows you 14% of those who are going to the institution looking for help are vaccinated people. The big blue section, 85.6% are unvaccinated people. You do not have to be a physicist or a mathematician. You only have to be a person who opens his or her eyes and see that the majority of people who are ending up in the hospital looking for hospital care from doctors, nurses, and their support staff are people who are not vaccinated. That is the conclusion you draw from that. And that is where the choice comes in. If you make the choice to say, I am not going to use the vaccine, you are also making the choice that you want to be in that piece of the blue pie where these are the people who are more than likely to end up looking for support. Look at the last bar below, the bar chart below. And you will see it's quite different to the chart at the top. Look at how much more blue is at the bottom. Those are the vaccinated people. The unvaccinated people. The ones that the little piece of green, the little piece of gray, right? Look at that. The vast majority, that chart down there is total deaths to date of the 3,156 people who have died. That blue section there are people who, for one reason or the other, did not use the option of the vaccine. And of course, one has to draw the conclusion that had they used it, the response could have been very much different. And one could do some calculations to indicate what kind of numbers we might have had we been heavily vaccinated. And we don't only look at ourselves, we look at other populations that are doing the same things that we are doing, slightly differently from place to place for all kinds of reasons. But the one thing we cannot say in Trinidad and Tobago is that we do not have the opportunity and the ability to vaccinate more of our population. So I would like the decision makers at the personal level to take away that pie chart, the circle, and ask yourself at the personal level which part of that chart you want to be in, the green part or the blue part. Of course, we have started, because we have opened our economy, as we have done, and I'm confirming it again, it is not the government's intention to close the economy down again unless something super damaging comes up in the context of the fight against the virus and what we know now of it and what we've experienced and what we have done to date. We want to preserve the gains we have made, and we want to survive in the pandemic. And one of the things that we do not have on the cards right now, and we don't want to have it, is the shutdown of the economy to try to evade the virus. We used that kind of mechanism twice before to buy time and to reduce our exposure, but now we are saying, as it's been said before, that we are now to prepare to live with the virus. Any day now I expect the authorities at WHO elsewhere to declare this virus an endemic situation, meaning that it's in the population and is likely to remain there so. You must remember when we started out in January, and we were talking about May, it might go by May, and when I said we were told by the experts we're looking at September of 2020, people say September, and when we close the schools for 2 weeks. We have children in this country, our junior children, who have not been to school for almost 2 years, and the pandemic is still raging at this point in time. With respect to the numbers of infected people in Trinidad and Tobago, we are at the worst we've been. In the United States, they are reporting over 1 million infections per day. This is a country, the richest country in the world, that had locked itself down when they were reporting less than 100,000 per day. So that should tell you how the population of the world has moved its response to the virus, because if you were locking down at 100,000, what are you doing being open at 1 million a day? You're doing that because we know a little bit more about the virus now and its behavior, and we also have millions of people vaccinated. We have, Minister, what's the figure we got there?
Of vaccine stocks?
Yeah, no, I'm talking about the number of people who have been vaccinated worldwide. Approximately 9.4 billion doses of vaccines. And of course, we have approximately 4 billion people in the world now who have been fully vaccinated as compared to when we were looking at a few tens of thousands of people. So it's not the same situation. And there's something that we could do and we are doing and we're encouraging, and that is to get vaccinated and be on that bus that says if you are on this bus, your chances are better. When you hear people saying that, well, the vaccine does not prevent you from getting it, and therefore, what am I being asked to be vaccinated for? Don't get into any argument over that, because I don't know how you could argue with that anymore. It's unnecessary to argue over it. Because what we are saying is not that the science has not generated a vaccine that can do that. But it has generated one that allows the death rate and the hospitalization rate to drop. Why would you want to ignore the opportunity to not be among the population, that cohort of the population that has the better chance of surviving? It is now being said by the experts that given the transmissibility of Omicron, that it is possible that virtually every human being would be exposed to it. When I spoke to you last week about the things we want to do, the curve we were looking at was a curve that says with that level of explosive transmissibility of Omicron, which was coming our way and which is in this country, at community level, that if it has any kind of effect on mortality like the Delta, we were looking at huge numbers of deaths in this country. Fortunately, that has not happened. Fortunately, we are not yet, and hopefully we may not get the right, but we can't anticipate that we will. We are not now being smothered by Omicron, but we still have a very effective action of the Delta variant in our population. And we need to prepare for increased infections, because that is what Omicron will do. Have to prepare for it. The one good thing about it, while we accept, as we're being told by the scientists, that it is very transmissible, with the passage of each week, we are seeing, when they look at the hospitalization arising out of the infections of Omicron, fortunately, it is not as it was with Delta. Thankfully, that is so, and that is still to be confirmed, but it is appearing so. We're keeping our fingers crossed and our prayers frequent that it is so, that yes, it's very transmissible, but once you get it, it is not as powerful with respect to dragging you down to the requiring hospital. But the population has all kinds of people in it. Very many people, many of whom don't even know that they have shortcomings in their health, in their personal health. Some who know and pretend that they are not at risk. And some who know and know that they are at risk, but for other reasons believe that the vaccination is not their way of dealing with it. That's the plethora of points of views. And it again comes down to choice. Nobody has held anybody in this country and physically vaccinated them. Nobody has done that. And nobody is promising that. It has always been a question of choice, but choice can have consequences. And choice is not a one-sided thing. So when we looked at our exposure, when we look at our level of deaths, when we look at the projections that we are facing, I said last week that, last time I was here, in December, that the government, as the largest employer, will manage its workplaces in such a way to acknowledge the vaccination program that is taking place, those who are vaccinated, those who are out, and to also acknowledge those who made the choice of not being vaccinated and their consequences to both sides. In Trinidad and Tobago today, the private sector has taken a number of steps in a number of places to keep private sector operations open for the benefit of all of us in Trinidad and Tobago, whether it's the manufacturing sector, the banking sector, the private sector is everything. Many aspects of the government sector is also open, and we are also vaccinated. I would like to ask my staff to put up the screen our vaccination in the public sector as of Friday. And again, as known to us, because I'm understanding that some people are being encouraged not to expose their status. Well, that has its own interpretation. And you would see Office of the Prime Minister, 70%. Attorney General, 60%. Department of Health, 75%. Finance, 78%. Trade and Industry, 81%. Public Admin, 75%. Tourism, 85%. Agriculture, 35%. Energy, 61%. Planning and Development, 57%. Social Development and Family Services, 83%. Foreign and CARICOM Affairs, 87%. Sport and Community Development, 76%. Public Utilities, 77%. Labor, 83%. Youth Development and National Service, 56%. Housing, 80%. Digital Transformation, 75%. Education, 50%. Communication, 60%. Works and Transport, 61%. Rural Development and Local Government, 46%. National Security, 34%. So, ladies and gentlemen, it ranges in the ministries from 35% to 87%. Now, there are a couple of departments there where, like agriculture, where people are largely outside, and also national security, which is among the lowest, which there's a lot of outside people there, but also a lot of inside people. But what this tells me, and should tell you, is that there are a significant number of people in the ministries that is vaccinated. Very significant number. And therefore, as we set the target of 80% as a target that the national community should benefit from, we then know where we're at and where we'd like to go. And ladies and gentlemen, when I spoke last time, I said the government is prepared to legislate so as to, like the private sector, manage the national vaccination program and the national safe zone arrangement, which is our way of living with the virus, being out there and doing the things that we want to do while the virus is raging or threatening to kill us. I said that I will ask the Attorney General to take responsibility for getting us to a point where the legislation can get to the Parliament. I can tell you, I'm very pleased that since the 19th of December, the Attorney General and his team have actively been in touch with significant components of the national community on this matter. And it has been useful. Some people choose not to cooperate. Some people choose to give themselves degrees that are not recognized in the clinical fight of the virus. And that is important because they speak for, or purport to speak for, a lot of other people who have given them the right. And in the period that the Attorney General has been out there, we know at the point, we are at the point now of where we have some documentation. Because one of the things that we are asking people for, if you're not agreeing with what the government is proposing, civilized and normal, tell us what you think should be done. Tell us what you propose. And we have had significant proposals in the last week or two. But let me just take you down the road of some of these proposals so you can understand what the national community is facing. I got 2 pieces of correspondence shared with me yesterday, dated 13th of January. The correspondence is dated 13th. Today is the 15th, so these were written 2 days ago, and I got it yesterday, last night in the Parliament. One is from the Joint Trade Union Movement, which, as you know, represents a significant number of worker representative bodies. And I'm happy that they did put their position in writing, because it allows the government to see the breadth of thought and, more importantly, the alternative that is available, because they did decide to write. And I simply want to quote a couple of lines from this 3-page letter. It's a 4-page letter. And on page 3, it says that we raised these, there are some issues on page 1 and 2. And it said, we raised these issues not to make light of COVID-19, but only to point out that there is a significantly low risk of death or hospitalization from COVID-19. Ladies and gentlemen, that is the position of JTOM. The government does not agree. 3,000 and counting, and 20 dead people every day, or 30 some days, is not significantly low risk. I may ask you to cast your mind back to the anxiety that we lived through when no person had died from COVID in this country. And when the first person had died, it was such an event that it was no less a person than the opposition leader who was out there informing the country before the family was told by the hospital department that somebody had died from COVID. It was the opposition leader. So nervous was this country to have that out. And we shut this country down when we were a lot less exposed. And to be told today, with a daily death toll of approaching 30, and don't know when it's going to drop and when it's going to stop, the government does not agree that it is a significantly low risk and that COVID-19 hospitalization is low risk. You hear Dr. Richards every time we meet during the week and here telling us exactly what is happening in the hospital. Apparently, people who have not been in the hospital or who cannot envisage what is happening in the hospital could talk like this. Ladies and gentlemen, our healthcare workers have done yeoman service to keep us where we are today. And we will not minimize their effort. I could tell you, because many of them talk to me as Prime Minister of this country. Many of our healthcare staff are at their wits' end, and some are even thinking of getting out of the profession because they have been standing in the gap to keep us where we are today. And we are in the 3rd year of a pandemic. What if this goes on for another year or 2? What is our position? So when we are told that the hospitals are almost full, as we were told in December, we were upwards approaching 80% occupancy. All the IC units are almost used. We are told today they are 90% occupied. What exactly are we saying? Because there's a phrase that is missing from this position, saying that what they are fighting for and what they will lay down for is the right of choice. I understand that. I accept that. But you know what that also is saying to the population? And I read that from this document. It's saying, let us leave it to choice, and who live, live, and who dead, dead. That is what is being said. A government in this situation cannot accept that as a response for a population in a pandemic that has already killed over 3,000 people. And there's another couple of lines I want to quote. On page 3 it says, "We appreciate that you may have statistical data which demonstrates that there's a significant risk of death or serious hospitalization arising from COVID-19 infection." Really? That the government of Trinidad and Tobago may have information about COVID deaths and the significant risk and hospitalization? And we talk to this population. There was a time when we were talking to you every single day. We talk to you now 3 or 4 times a week. But there are some people in the population who believe that the government may have some information that this is going on. And they are speaking here specifically about persons working for the state. We are not making COVID policy only about people working for the state. As the Calypsonians said early in the proceedings, the thing ain't care. Every single one of us in this country is exposed. I don't know if there's anybody in this room who doesn't know someone, and probably someone close to you in some way, who has died from COVID or has lost somebody who has died from COVID. I could tell you, very many of my days are depressed by the news of someone dying from COVID. And you don't have to be a member of your household to feel that death, because the loss hits you so hard that this person has just demised from having been exposed to a virus that we're fighting. Another one, somebody you know, somebody you've been with a month ago, and then the person's sister and the grandmother and the grandfather too. That is happening in this country. And some people are of the view that that is not what it's about. What it's about is to fight the government. The government is not prepared to get into any fight with anybody. The government is prepared to do what has to be done to defend the people of Trinidad and Tobago, and it's all by choice. All by choice. There's one other point I want to raise from the letter. It says, and I find this very interesting, they're asking for independent examination of whatever the government is saying and whatever the doctors are doing, because they don't accept and don't believe it. So they're asking for independent experts. And this paragraph reads like this. It is clear that the policy being advanced by the state is predicated on what appears to be purported expert opinion and evidence. Ladies and gentlemen, as Prime Minister of Trinidad and Tobago, that language does not describe the position of the government of Trinidad and Tobago. It's not appearing, it's not purporting expert advice. All these doctors and all them in the hospital, doctors, nurses, and their support staff, I would hazard a guess that 99% of them are people who have been trained, some of them paid for, by the people, the taxpayers of Trinidad and Tobago, to give us world-class expert opinion in public health care in the pandemic of 2020, 2021, and 2022. So if there are people who believe that the opinions of these people are purporting to be reporting or to be managing the healthcare system, I'm afraid that the government does not share that point of view. But there's something else that is said. It is also apparent that these opinions emanate from the state functionaries who have been working intimately with the political directorate and are predicated on data being collected solely by it. But ladies and gentlemen, if the government of Trinidad and Tobago, and let me put it differently, if the technical health experts in Trinidad and Tobago don't work with the political directorate in a pandemic, who are they supposed to work with? And if the government does not use the information and the technical expertise of those people, especially from the state sector, to fight this pandemic, who should the government use? So why should the political directorate feel that it must separate itself from the healthcare experts? And if we do that, who then do we depend on for information and for advice and guidance? The union leader? Well, there's one union leader who is now challenging openly the death certificates. And all I will say to that is that in Trinidad and Tobago, the government's position is that the best person to put data on the death certificate for any person in this country who was demised at a hospital or at home are the people who have been doing it before and who are authorized to do it, and these are the health experts. The health experts in the Ministry of Health, authorized by law. There's no substitute for that. So I'm sorry that the data is not being accepted in some quarters. That and if I quote another phrase, it says, they want a panel of independent experts to be appointed who will assess the veracity of the statistics. We've heard opposition members in the political arena saying that the government lied. At one point, they say it had dead people piling up high in Mount Hope, and the government hiding it. Another time, we hear them saying the government is inflating the number of deaths because the government wants it for political purposes. But, I mean, that is those in the political arena. But when Labour takes the position of saying that they are challenging the veracity of what the doctors are saying, I find that a little bit difficult to swallow. And, of course, because that has become the conversation in the pandemic, because we in the pandemic hear what we're talking about, disregarding the deaths, disregarding the daily tens of people dying, and saying that, well, the government lying to you, the doctors are no good. And as a matter of fact, it is being said by authority in this country now that the people who are dying in the hospital are not as a result of COVID, but as a result of inferior care that they're getting within the walls of the hospital. That's what's being said by persons who are in fact challenging the government's position. And you know, when I heard that, I felt so sad, because I know what the doctors and nurses are going through and are doing in the hospital. Every now and then you'll hear the uncommon thing of somebody here in this country saying thanks for having been in those walls. In fact, in today's paper, there's a story in today's paper from a woman who speaks about how she felt as a patient in that hospital. Very few people turn back to say thanks after. 1,000 things went on. If one went wrong, that one is representing the whole situation, the healthcare system. But we know that. But the bottom line is, because I do not think it is fair to these health professionals who have done for us what we never expected. We didn't expect that, because we were never really prepared for a pandemic in the way that the pandemic came upon us. We were just fortunate that we had within our system infrastructure and personnel to the level that we have had so far. And if you think it is bad now, it would have been 10 times worse had it not been for the dedication and the skill of the people who have been working with us and advising the government. And we don't expect everybody to agree with what they say. You don't need to do that. You can challenge everything. But when you do it in this way, disparagingly, we have to say no. And that is why during the week, I spent some time trying to find appropriate people who can go within the walls of the hospital and report back to the population what they have seen, what they've heard, what they know, so that the population can be comforted that what you are getting from the healthcare system in Trinidad and Tobago is the best that can be had. And if there are tweaks to be done, changes to be made, on that situation of report, we can look and see it. But certainly, we cannot take the position that I don't believe you, and you are doing it for some ulterior motive, or that our healthcare infrastructure is awful and that our staff is incompetent. So I sought and I found 5 of our best and most appropriate people who have agreed to go into the hospitals across the board and look at what is going on there, talk to the staff, look at their data, look at it with a professional eye, and come back and tell the country. Not get your information from people who think so or believe they know so, or who believe that it is their opportunity now to make manima through accusations and allegations, challenging the professional performance of our healthcare staff. So I've asked Professor Terence Simongal, who is the Dean of the Faculty of Medical Sciences at the University of the West Indies, to chair this 5-man group. In his group would be Professor Emerita Phyllis Pitt-Miller, consultant anesthetist and intensive care specialist, former Dean of the Faculty of Medical Sciences of UWI, Dr. Anton Komabach, a public health specialist and former Chief Medical Officer of the Ministry of Health, Dr. Vidya Dean, consultant anesthetist and intensive care specialist, and Professor Donald Simeon, Director of Caribbean Center for Health System Research and Development, Professor of Biostatistics and Public Health Research, Faculty of Medicine at UWI. These 5 people, under the chairmanship of Professor Terence Simongal, will go into our healthcare system, examine it, and at the end of the week, as long as they don't ask for more time, at the end of the week, they will report back to the government, and I give the country the assurance that as soon as I get that report, whatever it contains, it will be made public. And I do that so that the population can be guided away, you can't guide away from the Google doctors. That we have no control over that. We can't guide away from the Facebook specialists, but we can guide you away from believing that healthcare in the hospital is substandard and is contributing to the deaths that we are facing. Because if it is that you have to confront the numbers, the deaths, as part of the outcome of the COVID infection, and the way to explain that is to say, well, these people wouldn't have died because there's something going wrong in the hospital. I have to send these experts in now to respond to that. And I'll wait the report that they'll make to the people of Trinidad and Tobago. Ladies and gentlemen, so Labour has put in a package of suggestions and demands. The Attorney General has them. The Joint Chamber position on COVID-19 was also submitted on the same day, 13th of January, which is 2 days ago. And this, the same way JTM represents a number of Labour entities, this group, chamber, the joint chambers, AmCham, Energy Chamber, the Trinidad and Tobago Chamber of Commerce, and the Trinidad and Tobago Manufacturers Association. That covers a large swath of our economy and our population. And they have put some positions to the government, to the Attorney General, on the date on which I've just mentioned. And the reason why these documents probably would have come in that way is that as soon as I indicated on the 18th of December that we were looking in that direction and going in that direction, the Attorney General hit the ground and met with people, and they asked for the opportunity to put in, because he did ask them, what is your position if you think it's different to what the government do or might be doing? And they put it in writing to us. And I could just suggest, mention two to you that is in the document from the chambers. And it says, we recommend that all employers be given the ability, via the appropriate legislation, to declare their offices, factories, or other work sites as quasi-safe zones, and to therefore require all of their employees in that workplace to be vaccinated with exemption on valid medical grounds. They also said that employers should have the flexibility to determine their own policies on how employees who refuse to abide by their vaccination policy are treated, including placing employees on no paid leave. And of course, as you know, with the exemptions being available, the groups, the chambers have said that they would like to be satisfied that there's no hanky-panky with that, as we know with the sick leave situation. They would like, as employers, to have some say in who issues those medical exemptions for people. What this means, ladies and gentlemen, is that our population in the private sector and in the government, we are readying ourselves for living with the virus, not knowing when it's going to end. This thing going to go on for quite some time, apparently. But we want to continue doing the things that the economy does. We want to have some aspect of our lives continue with the risk of being hurt or killed by the virus being considerably reduced by the vaccination, and if we're very lucky, be among those in the blue part of the pie which says that you've been vaccinated, and even if you get infected, as people are being infected, that because you have been vaccinated, you have escaped the worst of COVID and its variants. Ladies and gentlemen, I've also, during the period, been consulting myself with a lot of people, many of whom have written to the government, expressing their views, their support, their concerns, their fears, and suggestions as to what we might do. So whatever the government does will be as a result of taking into account all of these inputs, including the inputs from labor, from the private sector manufacturing, from the Chamber of Commerce, from the religious bodies who have also put out certain positions to us, because all of us want to survive this virus, and all of us want to see Trinidad and Tobago prosper, even in a pandemic. I don't want to ascribe to anybody the ulterior motive of wanting us to fail, because failure in many families is the death of one or more members. That is too high a price to pay for any other agenda. So, ladies and gentlemen, we will do what we've been doing, making careful adjustments. But before I say that, because of how the last 3 weeks have gone, because we are now in a slightly more optimistic viewing of Omicron, because our health system has not been overwhelmed as the projections were at the 18th of December, I have asked the Attorney General to take a little more time. And of course, it can't be forever. So today I'm announcing that what we had intended that might have been done on the 17th of January will now be done somewhere about the 17th of February. We give the population a bit more time. I'm very pleased for some of the reports I've got from the public sector that we have improved some of our vaccinations. Some people have actually cooperated. There are many who are digging their heels in, and there are many who are being encouraged to not cooperate. But that is par for the course. We don't expect that overnight everybody will change their views. And of course, there are situations where the proof that what we are doing is not making sense is that somebody has got sick from the virus, or somebody has got a bad reaction. That reaction could be quite serious, to the extent that there are those situations the Ministry of Health and the government will be quite concerned, and there are protocols for dealing with them, and no person would be shortchanged in this way. But let us just say that in a situation where you have 4 billion people vaccinated, one swallow does not a vaccination someone make. Given the large number of people around the world who are using and benefiting from these vaccines, it is reasonable to say that the vaccines are safe and that the vaccination program is beneficial. The government will legislate and be in the same position of the private sector to determine which areas of governmental operations can operate under legislation, as well, safe zones are being attacked too. Because what is safe in a pandemic? Who can offer you safety in a pandemic? It's a relative term. Quasi-safe, it means that it's a place that you're, because of what is going on there, you're a bit better off or substantially better off. If we are all masked in this, if we are all sanitized, if we are all spaced out. But if the opposite is what we are doing, then that zone is not very safe. We know how the virus is spread. So to engage in a discourse over safe zone and safe zone not being safe and the vaccine not being useful because it doesn't prevent you from getting the virus, that is just to carry on an unproductive conversation. Let us focus on the can-dos. Let us focus on the survival rate. It is my view, and I may be wrong, but it's my personal view, that the insensitivity to these deaths is largely because one of the arrangements in this pandemic is that we don't have normal funerals. It is my view that if we were having normal wakes and normal funerals, where this population was participating and seeing the rituals of funerals 30 a day, 20 a day in this country, we might have been reacting differently. But we're hearing numbers, and we are reduced now to numbers, 50 dead, 20 dead, 10 dead, and then you have to listen to people telling you that they got their degree from some place that they read last night, and hitting 2 keys, and Dr. Parasam don't know what he's doing, and Dr. this and Dr. that. Those conversations are not helping, but the government is grateful for help from every quarter. And any quarter, it is for us to differentiate what is helpful and what is not. So we are going to do the legislation, and the choice is still there. A big part of the discourse is mandatory vaccination. And of course, our constitutional right, it would not be trampled upon by mandatory vaccination. If mandatory vaccination is about saving your life, how many of you are prepared to put a rope around and can jump off? I don't know. But whatever we are doing, it is not about dissecting the term mandatory vaccination, because frankly, we have been living with mandatory vaccination for decades in this country. And mandatorily vaccinating our prized possessions, our babies. To the best of my knowledge, the first person in your family who gets an injection is a young baby. Baby in arms. And it goes right up to school age. That is mandatory. But even with mandatory, there is choice. Because it says to get into the school system, education is available for free, but your child will come into the school system only if the child is vaccinated against measles, against polio, against this, against that, and we live with it. What we didn't have then, apparently, were opportunities to launch careers over saying no to that. But there are countries, where those same vaccines that we accept here for decades are still being resisted. It was last year, I think it was, or the year before. I remember reading a story about 12 doctors and nurses who were killed in Pakistan for applying polio vaccines. Yeah, polio vaccines. because the population was saying that the vaccines contained something that was haram. And, of course, they preferred to take the risk of children being disfigured. That's how populations go. With respect to the public sector, when the legislation comes through, after the conclusion of what the AG is doing now, the government will be in a position to designate where the workplace requires vaccination, and the employers will designate under the law, as we have already put in place, that they operate safe zones, because that, when we look at all that is available, this is the best way to keep the country operating as the pandemic continues to rage. The pandemic is not over. It doesn't even appear to be over. In Europe, in Australia, in the United States, in the Caribbean, Trinidad and Tobago is not getting a pass. You could badmouth the government as much as you want. You could badtalk the Prime Minister as much as you want. My concern is for you and your family. Because if at the end, when the pandemic does die down, God willing it will, if we are all here, it matters not what has been said and done to or about me and the government. All that matters is that not one person had died who should not have died. That is what matters. And we continue to do what we like to do, but not doing them as we would want to do. Last time I met you here, I told you about the beaches. Well, the beaches have been opened across the country. There was some rush. There was some gathering, I presume safe gathering, because I checked with the doctors, and we are not reporting any explosive negative reaction, because all along we have been doing this thing cautiously and carefully. And since we've got a good result so far, we can go a little further. So we'll stretch the beach time out to 2 o'clock. And I propose to speak to the Minister of Health about the equivalent in Trinidad, but certainly Tobago, I propose to speak to the Chief Secretary in Tobago, have a conversation as to whether the THA would, together we discuss it and see whether we could add in Tobago the restore type arrangements under the health protocols to begin that aspect of the economy. I am anticipating that could be good news. We can do that. And I am also very pleased that notwithstanding the best efforts, it took us a little while to come to a situation where those people who were upset by not being able to carry out their funeral rituals, they are now doing that. And it only applied to COVID bodies. Nobody had shut down the use of funeral pyres. It was the COVID corpses that were covered by that, and we have come to a position where we believe that we can do what has been announced, so that is good news for all of us, and those, particularly those who are affected by it. I also would like to allow access to rivers with serious restrictions following the no gathering of more than 10, no gathering, no fires, no playing of music, and no party. So the rivers can be accessed in that way, and as soon as it is not required, you remove the restrictions. Because, as I said with the beaches before, it was not that you were against seawater. It was how the gathering would have used it. And I think we are in a position to do that. And we will look to see and enforce the law. And, of course, consumption of alcohol. I know that you all probably would have had a time of your life. I was in Castaro last week in a vehicle. I went into a place that sold beers, and I had a beer, And on my way to the vehicle, I had this beer in a container, a plastic bag, which it was in. And it was such a hot and beautiful day. I sipping my beer, and then somebody came up to me and said, "You, consumption of alcohol in a public place is against the law. So you missed the opportunity of seeing me behind bars for breaching." It happened so easily, but it was a breach of the regulations. It happened so easily, I understand. But we really have to say, hold on for the time being. Do not go to the rivers for river limes and cook duck by the thousands and so on and so on. Let's get out there carefully for a while. Maybe after I speak to the Chief Secretary in the next couple of days or so, that the reef boats might start operating again. We look forward to being able to go on there. We'll have some restrictions that the CMO and the DMO over there would tell us what we can do. What I'm trying to get at here is, we, having accepted that we have to live with the virus, let us see how much we can do in the living, safely and sensibly. Right? And of course, as I said, it should not be equivalent to the reef tours or the swamp tours. If your boat is carrying 40 people or 30 people and the CMO says we go 50%, we expect that you comply. And if things go well, we get to better numbers. And the other area of serious concern and continuous stress for me is the school system. Ladies and gentlemen, those of you who are parents, I'm sure you know, and those of you who have relatives around you, you know what is going on with our children not being able to go to school. And while there are different points of views and cooperation or lack thereof, the bottom line is we need to do whatever we can to have some kind of a school system going on. We have made steps last year with our secondary school children, 4th, 5th, and 6th. There was not a consensus on that, but we did it by majority opinion, and it went reasonably well. And the Ministry of Health has been consulting widely, and we propose to go a step further to get some more of our children out. Forms 1, 2, and 3. We're still under consideration with any aspect of the primary school children, because they are the ones who are suffering worse. Because they've been out since last year, March. And I must tell you that if there's anything that could leave a lasting scar on this population, is a generation of young people who would have lost those formative years, that aspect of their primary school life. Because primary school is not just about examination and passing the exam to go to secondary school. It is learning to socialize. And the mental deprivation of even a year of that would have far-reaching consequences. And many parents and people who are handling children are already reporting that there are problems that we are going to have to deal with going down the road. So, as far as we're able to, taking the risks that are not too risky, we will want to carefully step out with more and more of our children, and hopefully, at some time in the not too distant future, have children going to school. And the more people who get vaccinated in this country, the better our chance of coming to that position. Because it is if you have a high level of vaccinated people, then there are benefits to be had from that. If the opposite is true, then we are asking for other things to happen. So, ladies and gentlemen, that's where it's at today. And Carnival is the last one I want to mention. I want to remind you again that the very nature of Carnival is all about what the virus would like to be going on. Carnival is a situation where we mix, we get gregarious, we out night and day, and so on, and in crowds. That is precisely what the virus would like, and the consequences could be grave. Nothing has happened so far to cause me to think differently. And what I said the last time, that Carnival 2022 will not be a normal carnival with street parades and gatherings and parties and jam up by the thousands. That is exactly what we shouldn't be doing at a time when the pandemic is infecting at its worst. However, because we have 500,000 people, vaccinated people, and we know a little more about how the virus behaves, we could have some elements of Carnival that take into account the health protocols that are in place. And that would be a matter for the Carnival fraternity, the Ministry of Culture, the Ministry of Tourism, and the Ministry of Community Development. Those ministers in the next few days, because we have taken this thing all the way down to the middle of January. We have not come to a place where we can say, yes, we can exhale, all is well, there's no virus, there's no risk, and we can have Carnival. That is not so. That has not happened. What has happened is that we have been called upon to live with the virus with a little bit of controlled Carnival. And of course, the experts say that a little bit of outdoor is better than indoor. We have protocols for indoors arrangement in place, and of course, we want common sense to prevail. Carnival 2022 is going to be a flavor with a difference, numerically smaller, because we don't want to have the gatherings that Carnival represent. It doesn't mean that we can't do certain Carnival things, but those things have to be determined, and we have to have cooperation and enforcement. So let that be Carnival. If you have any questions, we take them now.
Prime Minister Lucas Singh and the Trinidad Guardian, the 5 persons that you've appointed, were they selected through any consultation with the trade union, or was that a personal selection?
This is the government looking in the population for the appropriate people who can go across the health system and give us the answer that we need to know. And
the reason I ask is because we've seen the trade unions designate anyone that the government chooses as political functionaries. How do you think that they'll respect the findings of this group?
Let me tell you something. I'm a geologist, trained geologist. I have 3 degrees. And when you call me a politician, thinking that you're insulting me, maybe you are. I do not believe that the word politician or that politics is a dirty word. And I said to you early on, when it was said that these people, these experts, specialists, international quality specialists, are being deprecated because they are working with the government, I said the government does not agree. So anybody who wants to say that any of those 5 people, as a matter of fact, if I had read out their qualification, we'd be reading it all, we'd still be reading it. Anybody who wants to take the position, as a matter of fact, let me just tell you something. As head of this team, I know 1 person, or 2. I know 2 people on this team. I know Professor Miller, because she's been around in the public health system for quite some time. And I know Dr. Cumberbatch, because we were in Jamaica together in the 70s. I don't know the other 3 people. And I don't know if Minister Young knows them, or Minister Dial Singh. I know them because she was in health. Dr. Parswell and probably know all of them. But it is not a good thing for us to be behaving like that. You see, the casting of aspersions without a sound basis is not a good thing. So these people, if there are people who will want to denigrate them because they have been appointed by the government, all I will say is that as Prime Minister, I appoint the whole cabinet in this country. And on the same basis of logic, none of them should be in office because the Prime Minister, a politician, appoint them. We can take it to the ridiculous extreme, you know. I've seen it, I've heard it recently. Somebody got appointed by the president and the person was to be thrown out and denigrated publicly because the person was on something in a bank and the bank had lent money to somebody who knew the Prime Minister. Come on. So these are excellent quality, and if you notice, they didn't go there for any reason other than they are in a position to assess the situation. IC experts, clinical experts, and so on, right? So when they're going, they know what they're talking about. You and I can go in there, you know, and we see 10 tubes, one with blue ink, one with blue water. It means nothing to us, except at the end might be somebody struggling for his or her life. These are people who will know how to assess and report to the population on what is going on with our effort to fight COVID. And as I want to say it again, we are not the only country that is having this problem or even this kind of response.
The beaches, the open air cremations and access to rivers. When is this happening?
Today is Saturday. We talk about the beaches. Monday. We go to a new regime on Monday. We normally put the regulations in tonight into tomorrow, and they publish. So by Monday morning, we go with that. So next week we have a different week. Yeah? Yes, and of course the children who are going to go out, we are talking about in February.
Mr. Prime Minister, good afternoon to you. Rishi from TV6. I'm taking the opportunity to reciprocate to you New Year's greetings, of course, to you and to your family as well.
Thank you very much.
Can I, if it's okay, would I be able to ask the CMO if he would be considering updating mask guidance, if that is under consideration with the Omicron variant in circulation? Yeah. Because, you know, I read that the CDC on Friday sort of upgraded their guidance, suggesting that the N95 mask offers better protection against the Omicron variant. I know, we're just looking around the room, I think it's just two persons, Minister and Dr. Trotman, with those types of masks on.
Sure. So N95 by its nature prevents more viral particles or any other particles coming in and sometimes going out as well. But generally speaking, the recommendation is still surgical mask. N95 mask is acceptable. We're looking at a synergistic effect in terms of all the 3 Ws being utilized at the same time. So the spacing is important to go together with your masking. It depends on the type of setting that you work in. If you're working with a clinical setting where there's aerosolization, for example, we would certainly want you to have an N95, sometimes even with a shield. So it depends on the setting, depends on the individual level risk. But we're really asking everyone, I mean, surgical masks in this setting, seeing what is happening with Omicron, seems to be more aerosolized. But from a public sector policy perspective, I mean, we have been saying to wear masks for quite a while. It is now legislation. It is hard to get people to wear even one mask to cover your nose, mouth, and chin, right? So if we can have people wearing a mask properly at this point in time, we will take that for now. But the guideline, of course, says surgical masks and N95 give you better protection. For masks, as you know, we had done an assessment through TTBS, I believe, last year, showing good protection. Of course, it depends on if you wear one, if you wear two. And the plies. So for surgical masks, most of them are 3-ply, 4-ply, which is intrinsic to it. So it depends on the levels of protection, type of material. So TTBS, I think, does extend the service so that you could have that validated still. So you can look at your types of masks you're wearing. I'm seeing a lot of people wearing your surgical mask and then they're having a cloth mask on top of it, which gives you more protection. So there's variances of all, but we're really asking everyone to comply with the masking effort.
Dr. Richards would have spoken about, you know, the high hospitalization rates and so on. We saw that the WHO, they approved 2 drugs, baricitinib, you can correct me, and sotrovimab, I think. The first one treats severe and critical patients, and of course the second, mild to moderate, it says that they keep persons out of hospital. These are already approved drugs. Do we have them?
They were approved on the 14th, which is a couple of days ago by the World Health Organization. There are companies in Trinidad that are agents for those drugs. One is a tablet formulation, the other one is a monoclonal antibody. So we're looking at procurement on both of them. And as soon as, of course, we get any way forward, we'll let everyone know. But it has only been approved by WHO 2 days ago. Just to remind everyone, we do have the IL-6 inhibitors, which is approved by WHO as well. We do have dexamethasone on our formulary and is being utilized in the hospital. So we do have those levels of treatment. dexamethasone can be used from the start in terms of patients and has been giving good outcomes. IL-6 is more for moderate to severe, similar to the other type that you mentioned initially.
And just so that our population can understand, is Omicron mild or is it mild in fully vaccinated and boosted patients?
So I think the answer is that the world doesn't know as yet. However, to jump to a conclusion that it is mild is not following the precautionary principle that we have abided by from the start. So you have to be very careful, and even if you have something that is a little less severe than Delta, Delta is very severe by its nature. So it's being compared to Delta. Even if it is a little less severe, you're transmitting, it is much more transmissible. So if you have 1,000 people being infected, for example, with Delta, and 10% of those go to hospital, you're looking at 100 people, right? If you have a highly transmissible Omicron now coming on the scene, you expect that if the transmission increases, even though the severity might be a little less, the number of people requiring hospital care will go up, the number of deaths will go up. And that is the concern. And we're seeing the almost vertical lines in US, UK, and other parts of the world where Omicron has taken root. It seems from what we are seeing that we didn't get to that stage as yet. There's a lot of confounding factors with the way Delta has behaved in Trinidad. So we wait and see. But if it gets to that vertical level, you can almost assuredly, already starting at 70% hospitalization, hospitals being filled, that we will get to that 100% very quickly.
The AG sent out a press release about the open-air cremations, and in it he noted that the CMO kind of disagreed with having them once again. So can you ask what were or are the risks, if there are any, of open-air cremations, and if so?
I don't know that is what we are wanting to say. The decisions made on these matters are made by consultation, and it's not a question of somebody disagreeing while others agree, because there are things that, I wanted to do certain things as Prime Minister a long time ago, and they were not done because the team had a different view. And because we have said all along that we are guided, right? We didn't say wedded to. We are guided by certain principles. So whatever you would have got from that statement of the Attorney General, I think the biggest point there was that while there were the guidelines, some people were taking it as though there was the law, because the matter had gone to court. And it was, what was the government going to court to say? Well, there was no law saying you couldn't do it. It was a guideline, and the guideline was being enforced. So we had a proper look at it more than once, and eventually we thought that we should make it very clear that, here on in we can. And there are some things that at one point had looked a particular way, and there are some things because, as I said, even though we're not heavily vaccinated, but we are significantly vaccinated, so we could take a little more risk. So those are the considerations that go in there.
Mr. Prime Minister, as the CMO spoke about, with the Omicron, we may still get same or more hospitalizations and deaths with respect to from the Omicron as compared to Delta. Are you at a position to say if the government will be considering the mass storage of bodies, and also what is the status of public burial grounds? Are they to capacity? Because we're getting a little reports from the ground.
Well, I thought the people who deal with those things have been talking quite a lot, because I myself have learned a lot from what the Association of Funeral Directors have been saying. The first thing that they have said is that we do have the capacity to deal at crematoria with the level of bodies that we're having. They've also said that there is some element of backup, because people are not being buried as they die for a number of reasons. Some of those reasons can remain. And I don't know that that's going to change much. So in terms of whether we're going to store bodies, that's a bridge you have to cross when you get to it. You would have seen the Tobago House of Assembly. They have one mortuary in Tobago, and it only has a certain capacity. And it didn't cater for a pandemic. So it is reasonable, because the mortuary was not built to deal with that number of dead persons per day, there was not space in there to properly and in a dignified way handle the bodies. So the next thing is to find a refrigerated container. And in Trinidad and Tobago, the funeral directors had taken the position that because bodies were not being buried immediately upon death, and you needed to have them held while the population would come and do the needful along the way, they had organized themselves to find a place where, in a proper and dignified way, these bodies is like a large mortuary, because it's a mortuary. And of course, you saw there was a reaction to it and so on and so on. But I hope that we never get to a situation where that becomes a problem that we can't cross very easily. And if there's not enough space in the mortuary, then we have to find refrigerated space somewhere else. And I'm sure, Dr. Parasam, do you have any update on that? I did understand that we were looking at some other situations at some of the other sites to increase our holding capacity for people who...
So what we have been doing is working very closely with the RHAs, having a look at their systems and the procedures in place, the SOPs within the individual RHAs, and the CEOs have been leading that very well. I think Northwest has been able to have a particularly good situation in which we have kept their mortuary well below capacity for quite a long period of time. And using the lessons learned in Northwest, we're applying that to Southwest. Eastern has always been able to get rid of their backlog in a very short period of time as well. So Southwest, I was told by the CEO only a few days ago that their situation has improved significantly because of the measures they have put in place. And as the Prime Minister said, there are hurdles to cross, for example, with people being in quarantine, relatives being in quarantine, some of the issues, people not claiming their bodies on time, those kinds of things, which are being dealt with sometimes using virtual platforms and other things. So we're getting to a situation where you're seeing some clearing of the backlogs occurring.
The burial grounds, the public burial grounds, are they close to capacity?
Many of them are reporting very heavy usage. Once again, the rate at which we were using spaces in the burial grounds around the country, that rate would have increased because that's what a pandemic does. It generates a larger number of bodies requiring space. And, you know, this is part of the pandemic story. In New York, I think it was early this year, in the city of New York, they had a situation like this where virtually all their large hospitals, in the parking lot, they had a large number of refrigerated containers to store bodies. And even that, they had exceeded that. And there was this one situation where they had to go and literally do trenching and store bodies numbered in bags. Because, you know, one of the challenges is that some people would have died and their family didn't even know they had died. I've seen that reported in the papers here, where people looking for somebody who they have not seen for a while, who is very close to them, member of the family, only to discover that the person was in the system, had passed away, and they didn't know. So all kinds of things are happening in this pandemic, and we just have to not let it overwhelm us, but make sensible decisions.
So we've seen countries like Singapore, they are now trying to float legislation that says that if a person chooses not to be vaccinated and they are hospitalized, they're going to have to pay for that hospitalization. Is the government considering that sort of peripheral legislation?
No, we have not. Societies do things depending on what societies are prepared to accept and what they've been doing and so on. I know we always compare ourselves with Singapore. There's very little about Trinidad and Tobago that is Singaporean. Okay? So, and if you look around the world, what we normally do here in Trinidad and Tobago, we look at other Commonwealth countries to see. But even in the spectrum of Commonwealth countries, you saw what the Prime Minister of Canada was considering this last week? The Prime Minister of Canada is considering some serious things that we are not even thinking about. And even if we think about it, we mightn't go further than thinking about it, because in Trinidad and Tobago, that is not, to put it lightly, that's not our culture. And there are people who cooperate with a heavy hand of authority, and there are people who rebel against any kind of authority. And there are people who believe that it's going to be a miracle and just going to go away. So in Trinidad and Tobago, we have to do what is reasonably acceptable in our society. And of course, people go to court, and the yardstick that the court uses to adjudicate upon what the government does is whether the action of the government and the parliament is an action that is reasonable in a society like ours.
We have gotten some reports, Minister Dialsing, of dispensaries in eye clinics, smaller eye clinics being closed down, and people are being redirected to more central locations. Is this the case? And if so, why so when, we're asking people to separate more? And
So the particular details of that, I will have to check on. What I do know, and I said this publicly late last year, in an effort to divert resources to the COVID fight, we would have had to shut down some outpatient clinics. So it is possible what you are asking about is as a result of that. That is typical pandemic response in the health sector when you have limited resources and you are trying to rush people to where they are needed the most. So I did say outpatient clinics would be affected, but we will look into it. Thank you.
In the context of that question, you would also have seen in some countries, some cities actually, that the authorities have taken the decision to cancel elective surgery. Elective surgery being surgery that you choose to do at a particular time. Just cancel it because the human resource in particular isn't available, or the hospital, the bed space, the ICU isn't available, and so on. So these are fallouts from the demand that the pandemic is making. Again, I must say, not only on Trinidad and Tobago, but worldwide.
So over the Christmas period, there was a party on a boat. Police have had reports of a party on a boat, and organizers. There seems to be some involvement of two of your ministers. One would be here presently. Are you concerned about their conduct, the AG's conduct and involvement in this?
I am concerned about the conduct of every member of the cabinet. So if there's conduct by a member of the cabinet that is inimical to public interest, and I'm satisfied that that is so, then you wouldn't have to ask me that. With respect to who might have partied or didn't party, I regard that as a matter of law enforcement, and I leave that entirely within the realm of law enforcement because, as you know, the government has no role in law enforcement where it has to do with holding people for breaches of the law. The aspect of the government that does that is quite clear, not the cabinet, not the prime minister. If there are persons who have got themselves in trouble with the law, they blow their nose where they catch their cold.
As it relates to government's legislation that will be coming on the public sector safe zones, the furloughing of unvaccinated persons, is that still up for discussion? Is it still on the plate?
Yes, it is up. But fortunately, as I showed you the number of people who are vaccinated in the public sector, in the ministries, I didn't touch on state enterprises. But where we are heading is that, fortunately, it is not as bad as it could have been, and it's improving. So we are, in fact, going to continue to improve in those areas. And because the government has such a broad spectrum of employees, we don't want to use a one-size-fits-all. We are going to use sizes to fit situations governed by the requirement to provide a safe workplace. And that is what the Attorney General is working on now with the consultation process, and I think his office has a draft already. But we are tweaking that draft and doing it in the context of even the changes that we talk about today of what the virus holds out to us. If we were under an Omicron cloud right now and hospitals with thousands of people, it would have been a completely different story. But we know that we are not out of the woods, so we're going to keep our act sharp.
As you prepare to open schools and...
As is appropriate here.
As you prepare to open schools, I have to ask this question. On behalf of the children, we're preparing to open schools. Are we considering the vaccination of children with that particular age group again?
We do have vaccines in place and available for children aged 12 to 18, quite a number of parents have allowed their children to be vaccinated, and we consider those children additionally protected. But we've allowed parents to take the risk for those who are unvaccinated. As a national policy of vaccinating minors, once there is a vaccine that's available, approved for children, whether it is measles, mumps, whatever, we already have a template on that. And I said early on, if that vaccine is available to protect our 1 day to whatever, and we can access it, and we are able to access it, we will make it available in Trinidad and Tobago. And that may be where the story of mandatory vaccine comes in, because we are already there. Thank you all very much for coming, and thank you for covering our reports and advising the population that the pandemic is still going on.
Vegan food, what's it?
Do what?
And they also vegan food. And they also have to box it.
No, man, they tell me.
They have to have the fire whole squad for that time.
You're saying that way. Just wait. You said the security guard. When
Wi-Fi working security. Our last company was working. Right? No, our last company was...
you call no name though or nothing.
No, our last company. I know I was working with the company. I went to hide and collect food too.
Which in the last election, I went without ID to vote, and they checked the boundaries of election, see everything, and I made my finger.
That is the one that the UNC then win.
Right. Right?
Right. So why your ID and your driver's license back and take?
And what one is when the mayor come and interview me here and I explain him, I said, look boss, that's the reason why I out here, because I decided.
So the mayor help you to get back your ID?
No, man, working on a place with a stay beside the home.
Right.
I trying to get a place on the hotel scheme and try to assist me with these things. But you know, the man I work to do, so you gotta be, so you're telling to me, part-time, I love this boots. The mayor buy this boots, man. Right? This is the mayor.
Press it down, let me see. Nice.
And this is a quality boots. Yeah, right? The mayor give me the boots, you're gonna have to get